My name is Cindy Nabel Garzón Lavalle, and I'm going to talking about ECG pattern associated with left anterior descending coronary artery occlusion. Definition: the left anterior descending artery, also LAD, anterior interventricular branch of the left coronary artery, or anterior descending branch, is a branch of the left coronary artery. Occlusion of this artery is often called the widowmaker infarction due to a high death risk. The artery supplies the anterolateral myocardium apex and interventricular septum. The LAD typically supplies 45-55% of the left ventricle (LV) and is therefore considered the most critical vessel in terms of myocardial blood supply. The widowmaker is an alternate name for the anterior interventricular branch of the left coronary artery. The name widowmaker may also apply to the left coronary artery or several occlusions to that artery. This term is used because the left main coronary or the left anterior descending supply blood to large areas of the heart. This means that if these arteries are abruptly and completely occluded, it will cause a massive heart attack that will likely lead to sudden death. The blockage that kills is made up of platelets streaming to the site of a ruptured cholesterol plaque. Even a small amount of plaque in this area can, for a variety of poorly understood reasons, rupture and cause death. Bypassing chronic blockage or trying to open them with angioplasty does not prevent heart attack, but it can restore blood flow in case of a sudden blockage or a heart attack, and if performed within a rapid time period, can minimize the damage done. Applications in medicine. A 36-year-old man presented to the emergency department with a substernal chest tightness of 6 hours duration. The chest tightness was initially intermittent but became persistent for 1 hour before presentation. He was a current smoker with a smoking history of 10 packed years. An electrocardiogram ECG showed upsloping ST segment depression and told symmetry T was in length B2 through B5. The result of an initial troponin 1 test was normal. This overlapping ECG pattern of ST segment depression that continues into total. Symmetric T waves in the precordial less, sometimes referred to as the winter pattern, has been associated with the occlusion of the proximal left anterior descending coronary artery. The patients underwent immediate coronary angiography, and the procedure revealed 95% stenosis of the proximal left anterior descending coronary artery. The stenosis was treated successfully by means of percutaneous coronary intervention. With stent placement, the troponin 1 level rose to a peak of 7.90 mg per milliliter. Normal value less than 0.06 40 hours after the procedure. A post-procedure ECG showed evolution of the ST segment and T weights change with new T weight inversion in left 1 ABL and B2 through B6. The patients began guideline directed medical therapy and was discharged home. He also received smoking cessation counseling and was referred to a cardiac rehabilitation program.
The name itself sounds frightening, the Widowmaker. In terms of a cardiac event, it's named for good reason.
When this happens, half the people die unless you open those blockages pretty quickly.
It's caused by a sudden blockage of the left anterior descending artery, which gives circulation to about 2/3 of your heart.
When it is completely shut off, there is no oxygen going to the heart muscle. If you don't get treatment immediately, it's possible you could die before you realize you're having a heart attack.
By some estimates, the survival rate is between 5 and 10% because this heart attack comes on quickly with little or no warning. The best way to cheat on the Widowmaker is to know your risks.
If you know that someone in your family has a heart attack, your chance of having a heart attack is definitely higher.
People with a strong family history should be cautious, especially if they have other health conditions which impact heart disease, including hypertension, high cholesterol, and diabetes.
Make sure you talk to your doctor. Make sure you are getting proper treatment for those things. The other things you could do on an individual level: physical activity, exercise 4 to 5 times a week. Make sure you're eating right. Make sure you're not smoking. And make sure you lead healthy, active lifestyle.
By showing your heart some love, monitoring your health under a doctor's supervision, you're more likely to keep the Widowmaker away. For Lee Memorial Health System, I'm Amy Osher.
Pros: ECGs are able to detect any cardiac dysrhythmia, again based on the principle that each dysrhythmia produces different electrical patterns. It is highly diagnostic method as it represents that in topographic form. It can detect any silent cardiac condition which could be the result of surgery and anesthesia. It is inexpensive method. It is safe method. The ECG equipments are widely available. It is easy to perform, give a detailed account of conduction system of heart. Analysis the ECG in coronary disease and cardiac arrhythmias, a heart attack, myocardial infarction, and if it was recent or some time ago. A heart attack causes damage to heart muscle and it is held with scar tissue. This can be detected by abnormal ECG patterns. Exercise ECG. In this test, a tracing is done when you exercise on a treadmill or exercise bike. This helps to assess the severity of the narrowing of the coronary arteries which cause angina. Cons. It provides static pictures which may not reflect separate underlying heart issues related to patients. It uses words and probes for testing. It restricts body movement. Also, not all heart attacks can be detected by ECG. Angina, a common heart disorder, can now usually be detected by a routine ECG.
Common symptoms that people think of when they talk about blockage in the heart is chest pain, and that is the majority of the cases. Having said that, there's times where people presented with what we call not typical symptoms. Diabetic, for instance, in females tend to present in non-typical symptoms more often. That could be just upset stomach, just overall not feeling well, dizziness. Sometimes the pain is in the back and the jaw and the shoulders. It's not just the chest pain that could be a symptoms of blockages in the arteries. There's two ways to diagnose the blockages. There's what we call non-invasive tests, such as stress tests, ECGs, and so forth. Those are great initial screening tests. They're very non-invasive and safe. The problem, or the limitation I should say, is the sensitivity of those tests. It's about 85%, meaning there's 10-15% chance occasionally we can miss something on those tests. The ultimate diagnosis for blockages is with the heart catheterization, but this is a little bit more invasive test, so we reserve that to situation where the suspicion is really high, or if somebody had an abnormal stress test. And that test basically going inside the body with a small catheter and injecting contrast. This is a 100% test. There's either blockages or not. Doesn't have any false negative or false positive to it. Any blockages is concerning. What it's different is how you treat it. Mild blockages does not require intervention, meaning balloon or stent or surgery. The focus more is on controlling the risk factors such as high blood pressure, cholesterol, diabetes, smoking, and so forth. In more advanced phase, when the blockage is severe, meaning more than 80% or so, then this is when it's time to intervene on the blockage, whether it's with stent or surgery or whatever it's appropriate for the particular blockage. It becomes a technical issue.
Issue that bleed in Ecuador. Acute myocardial infarction is the leading cause of death from heart disease and accounts for more than 25% of overall mortality. The condition is caused by the sudden decrease in coronary blood flow secondary to the thrombotic occlusion of a coronary artery previously damaged by atherosclerosis. It is characterized clinically by the presence of oppressive retroesternal pain lasting more than 30 minutes and may be accompanied by swinging arrhythmia, syncope, hypotension, heart failure, and shock. The electrocardiogram shows elevation or depression of the ST segment, inversion of the T wave, and presence of the pathological Q wave. Infarction with Q wave, the latter may be often led to no Q infarction. Elevation of enzymes such as C, K, MB, troponin T, and troponin I are essential for diagnosis. Thrombolytic drugs, streptokinase, alteplase, TPA, reteplase, and enitroplase constitute the specific treatment and should be administered in the first 3 hours. Revascularization, coronary artery bypass, or percutaneous transluminal angioplasty is a therapeutic option. The prognosis of acute myocardial infarction depends on the degree of myocardial necrosis and early treatment. Risk stratification allows adequate post-infarction and management. Every year there are several million deaths in the world due to acute coronary disease, which is considered epidemic proportion, responsible for the deaths of a third of men between 45 and 55, especially in developed countries. In the USA, 1.5 million cases are reported per year and the mortality rate is close to 30%. And all countries' mortality in men is greater than in women. For more than 20 years, heart disease is the leading cause of death in Cuba, in particular deaths from acute myocardial infarction. AMI represents around 50% of all deaths throughout the country. In the last 38 deaths due to ischemic heart disease have increased, where the IMA has the fundamental weight, with almost two-thirds of the total deaths recorded. Conclusion: I think that this upsloping ECG pattern of ST segment depression that continues into tall symmetric T waves in the precordial legs, sometimes referred to as the winter pattern, has been associated with the occlusion of the proximal left anterior descending coronary artery. Primary percutaneous coronary intervention is the gold standard treatment for acute coronary artery occlusion. It is primarily diagnosed by ST segment elevation on an ECG accompanying ischemic sounding chest pain. The admission ECG in patients with ST elevation acute myocardial infarction is valuable not only for determining who should and should not receive early perfusion treatment, but also for providing information regarding the location and extent of acute myocardial injury. By reflecting the pathologic psychology of the myocardium during acute ischemia, the ECG combines information unique from that of coronary angiography and provides important information to get clinical decision making. In the previous AMI, an exclusive disease of the AD, the ECG can be a useful tool in the prediction of the lesional level of AD and in relation of its main branch.
Could you explain what a widowmaker's artery is? That's really a cute statement, but it's a terrifying statement. What's a widowmaker? The heart is a sophisticated muscle that pumps about 70 times a minute. It requires a blood supply. That blood supply to nourish the heart muscle comes from coronary arteries. There are three main divisions of the coronary arteries: the part that covers the right is called a right anterior descending. It covers the right part of the heart, the part of the heart that sends blood up to the lungs to get all that oxygen, brings it down to the left side. The other coronary artery is a left anterior descending. Now, it covers most of the left side of the heart. That's the big pump. That's the pump that sends blood down to the and up to the head to the rest of the body. Off of that left anterior descending, there's a blood vessel that goes around to the back of the heart. Now, all three of these vessels enclose the heart, and they sort of communicate with each other. But that one coronary artery that's on the left anterior descending, if you have a sudden episode where that blood vessel suddenly blocks, and that's what a heart attack is, a cholesterol plaque breaks through and it's like an airbag, and it just closes off that artery. When you close off that left anterior descending, you've only got 5 minutes to get to the emergency room. Most people can't get there in that period of time, and it frequently causes sudden death or the massive heart attack or the heart attack that causes sudden death. It's the left anterior descending. How do you know it? That coronary artery is bad in your case? Well, you need to have a regular checkup with your doctor. You need to know the risk factors for coronary artery disease. It's high blood pressure, it's a bad cholesterol, it's sedentary activity, and it's cigarette smoking. So if you've got those things, you need to work out a program with your doctor so that that left anterior descending coronary artery won't become blocked and clogged in your case. A stress test that your heart specialist will do sometimes will bring out some factors that let you know that that vessel is diseased. There are some calcium scores that we can get for the coronary vessels. Lots of new advancements, but that's what the widowmaker's artery is.